nurses stop complaining, this is what you signed up for, because I didn't sign up for all that. Hi guys, my name is Yesiela and welcome back to Living Life with your favorite nurse. So if you're new to my channel, don't forget to subscribe and join the family. And if you're one of my returning subscribers, welcome back. So today we're talking about something that I wanted to talk about before the pandemic, during the pandemic, as we're still here. But I've just never had the chance to do it. I don't know why, but here we are today. We're gonna talk about it. So today we're talking about nurses stop complaining. This is what you signed up for. This is what you signed up for. Nurse stop complaining. Basically, that's it. Woo, Chile. So I'm just gonna say some things on my mind because I saw a headline with that exact sentence. Nurse stop complaining. This is what you signed up for. I've seen some tweets. I've seen some things, and I've talked to some people. So I was like, I feel like I should talk about, you know, some things, what I think. So, the beginning of the pandemic, a lot of nurses worldwide didn't have, let's say, enough PPE, enough things to protect themselves. So PPE is personal protective equipment. Basically, my personal protective equipment. And PPE can be wearing your gown, so that can prevent, you know, any fluids or any, you know, germs coming on you, coming on your clothes. You know, a visor, a mask, goggles, gloves. Those are things that can be used as PPE. So like I said, a lot of nurses, a lot of healthcare workers, let's say, didn't have enough PPE. So a lot of nurses have protested and complained that they don't have personal protective equipment, and they're scared. They're scared because they still need to treat the same people that can infect them, that could possibly kill them, that could possibly hurt them without personal protective equipment. Something that we did not sign up for is to care for someone unprotected. As a nurse, it is my job to protect you, and that's what I'm going to do. I'm going to care for you and protect you as much as I can, but I also need to be protected. When I really thought about this and I heard someone say, like, it's your job to care for them no matter the risk, I understand that. But it's also the job of, let's say, management that is meant to support nurses to also be able to provide these things if they also expect us to do the job that we need to do. When I thought about this, my head went to a firefighter. I don't know, I could be wrong, but I've never heard of a firefighter complaining that they were sent into a burning fire without, you know, their helmet, without all their fireproof gear. Would you send a firefighter into a burning building without those protective equipment? I think about that. There's no way we would ever expect a firefighter to do that or to go into a building without any protection on them, because in a sense they're useless. They'll get burned, they'll get hurt, and they're risking their lives. They're still risking their lives going in there at all, but at least they have something to protect them while they're doing their job, while they're trying to care and help other people. So why is it different when a nurse tries to express that same thing? Why is it different when a nurse says, how can I care for someone with COVID if I don't have my mask, my gown, and all these things that I need to protect myself? Because if a nurse now gets sick, they can't come into work and help. They can't come and now help these patients. They're useless now to their patients because they have to stay home. And not even just staying home, their lives could be at risk. This could be the nurse that dies. You know, this might be the disease, whether it's COVID or a different virus, something else that gets this person. And then they're not helpful to anyone. Unfortunately, they're gone. They've lost their lives because they weren't protected. So it really bothered me when I heard people saying, like, why are they complaining? This is what they signed up for. We signed up to care for people, but we also signed up to be protected as well. Another thing that I've heard people say, why are nurses complaining about, is that, you know, they're burnt out and they're understaffed and they're working like long hours. Don't get me wrong, we heard that nursing from day one was going to be difficult. We're not asking for it to be easy. I don't ever think it will be easy because that's the job. Taking care of someone is, I don't think, just can be easy. It will always be difficult one way or another. But what is difficult is, let's say, when the standard is to take care of 4 people. Even 4 people is a lot, but you have to now divide your time among these 4 people and give them excellent, adequate care. But now, instead of treating 4 people, you're treating 6 or 7 people. When it was already difficult enough to treat your 4 and make sure you're all giving them proper care. So what is hard and what is difficult in that is, how are you expected to give everybody adequate care? How are you expected to do your best, not make mistakes? How are you expected to do the best job that you can do when now you have to split yourself into more people? That is one thing that I always found like really flabbergasting when nurses would complain, that word, complain about workload, having too many patients, and people are like, what's hard in that? I would say, think about having kids. I don't have a kid, but just all the shows I watch, you go from 1 kid to 2 kids to 3 kids to 4 kids to 5 kids. They're exhausted. Parents, whether mother or father, they're exhausted. Why? Because they have more people to take care of. And it's just like that with your patients. I'm not calling them kids, but again, you have more people to take care of. And sometimes, let's say if you have so many children and you just don't have the capacity to take care of them, they may lack some things. And for me as a nurse, I don't want anyone to lack. Whether you're sick or not, there's a reason I'm treating you. There's a reason that you need treatment. So you need something from me. So as a nurse, I want to do the best that I can to be able to provide that to you. But it's so difficult when I'm also trying to do that for other people. Obviously, there's so much stuff that has to go into improving that, whether it's hiring nurses or other stuff. But it's definitely very painful to hear when you're explaining how workload can be so hard on you, especially it burns you out physically, mentally. Most likely you will not have a lunch, you will not have a break because you have all these people that you need to do things for, medication, labs, calls, interventions. There's just not enough time for you. And again, for me, if you want me to give your mom, your sister, your brother, your grandparent the best treatment, I also need to be treated well. I'm not saying I need a massage at lunch, but that might just mean being able to actually sit down, catch my breath, drink some water, get it together, and go again. But sometimes you might not be able to do that with workload, and that's why we complain, if it's called complaining. Yeah. Another thing that we also did not sign up for that we may be told that we complain about is also the treatment we get from, honestly, anyone around us. I didn't sign up for being slapped. I didn't sign up for being hit, being yelled at, being cursed at, being insulted. When I said my oath on graduation day or on my pinning ceremony, which I don't exactly remember the full oath, I did not say I pledged to being insulted. I understand that everyone is going through something, but you should also treat people around you with respect. You might have just lost someone. I understand that. I will be as kind, as compassionate as I can be, and as I should be, because I want to be. But doesn't mean you should treat me or scream at me or throw things at me. And it's also important to remember your nurse, your doctor, whomever is around you is going through something as well. We have families, we have parents, we have loved ones. Some people have children. Some nurses' children may be in the hospital. Some nurses' partners may be in the hospital or going through something. So again, we may complain, oh, he hit me, oh, she cursed at me. It's not that we can't take it, because we can, but we shouldn't have to. We take a lot of things that we shouldn't have to take. I understand that people around us are frustrated because health concerns are frustrating. I don't expect you to be hunky-dory, singing me songs, smiling all the time. No one needs that, to be honest. It's great when someone is smiling and your patients are happy, but I understand you're going through stuff. You are allowed to be upset. You are allowed to be moody. You're allowed to be sad. But at the same time, that doesn't mean you should swear at me, call me useless, or even use that time to use racial slurs. Like, there's no reason for that. How does that benefit you? So even when, like, I was touched one time by a patient and someone was like, oh, that's just part of the job. Again, it's not part of the job, because I didn't sign up for someone touching me. I signed up to care for someone, and again, it happens. But if it's something that's continuously happening and we're just saying it's part of the job, it will go on forever. There are those things that we need to look at a higher level, like how can we stop these things? Like, how can we stop condoning these things? Because I feel like we condone them, whether it's from the patient's family, or even some of the higher staff that are like, it happens, and you know, maybe it shouldn't keep happening. So it's hard to sometimes hear that nurses complain, this is what you signed up for, because we signed up to care for people. No one ever said it would be easy, and like I said at the beginning of this video, I don't expect it to be easy. I know what I signed up for. I expect it to be challenging at times. I expect it to not go my way. I expect to have hard days. But you shouldn't be going into a burning building without your gear. You shouldn't be burnt out every day because of workload. And it shouldn't be okay that you're touched, cursed at, or hit, you know, daily or regularly because it's part of the job and that's what you signed up for. So these are things, you know, that have just been like on my mind that I was like, okay, I have to share. I need to get them out, because I think it's just important to know that these are things that nurses go through. And yes, like, I'm not saying that people don't complain. Personal people may complain about this, may complain about that, and those are complaints. You can say that everyone complains about something, but these things in particularly, I think, need to be changed and need to be fixed. But you know, in all due time, eventually they'll get better. So don't say, nurses, stop complaining, this is what you signed up for, because I didn't sign up for all that. But anyways, that's just what's on my mind. Feel free to leave me a comment, send me a message, whatever you like. Thank you guys so much for tuning in today. I hope you guys have a blessed week and keep living life from your favorite nurse.